Ladies and gentlemen, we will begin in 30 seconds. We also ask if reporters can leave their video off. Okay, good afternoon. We're going to get started with our virtual press conference for the press office. And our speaker today is Dr. Rachel Levine. Dr. Levine.
Well, thank you very much. Good afternoon. As of 10 a.m. this morning, 5,877 people are hospitalized due to COVID-19 in Pennsylvania. 1,218 of them are in the intensive care. 75 patients on a ventilator. The trend in the 14-day moving average of the number of hospitalized patients per day has increased by 4,400 since the end of September. Many hospitals across the state have few ICU beds, if any. The Keystone Region Healthcare Coalition and the Healthcare Coalition of Southwest Pennsylvania have had a third or more of its hospitals anticipate a staffing shortage for now the second time in 10 days. Today, we are reporting 11,972 new cases of COVID-19. This brings the total number of COVID-19 cases in Pennsylvania to 457,289. Of our total cases, the number of people who have recovered from COVID-19 continues to decline. Now, almost half of our cases have become infected in the last 30 days. We continue to see increases in the number of new cases in younger Pennsylvanians. Since the start of the pandemic, there have been 37,512 cases of COVID-19 among 5 to 18-year-olds. More than 9,500 of those, or a quarter of those cases, have been recorded in the last 2 weeks alone. Tragically, 248 new deaths have been reported today, for now a total of 12,010 deaths attributed to COVID-19. Each of the last 2 days, we have reported the highest number of deaths since the beginning of the pandemic. In the last week, we have reported close to 1,100 new deaths across Pennsylvania from COVID-19. Clearly, the impacts of this virus continue to strain our healthcare system and the vitality of our communities. COVID-19 is a respiratory virus, and its spread can be difficult to track indoors. Dr. Meta Higa is a professor at your college and a virologist, and she joins us today to share how viruses such as COVID-19 spread and why it's so important to wear a mask and to social distance. Dr. Higa.
Thank you, Dr. Levine, for that introduction. I'm sure by now many of us are growing tired of COVID-19 and the effects it has imposed upon our daily lives. My family and I continue to weigh every decision from how we do our grocery shopping to how to celebrate birthdays and holidays safely. And we are tired too. First, there's good news. With vaccine distributions beginning shortly, we can at least see the end of the tunnel. And in the past year, scientists have been working nonstop to understand more about the virus, how it spreads, and how best to treat it. This research has resulted in better recovery rates for those infected and is being used to inform decisions on how best to open up the economy while still mitigating spread of the virus. If we can keep up our efforts a bit longer, we should hopefully be able to relax a little bit once the vaccine is distributed widely. However, until then, the warmer months of summer are behind us, and the colder climates mean that we are increasingly moving indoors. The data regarding virus spread indoors is well studied and clear. In closed spaces, in areas where people are less than 6 feet apart, and in areas of poor ventilation of outside fresh air, time and time again, we see virus transmission. The outcomes are worse if we are singing or cheering like at a sporting event, or breathing heavily like we might do working out. In these studies, and there are many, transmission is seen between individuals with no contact, such as passengers on a bus or restaurant patrons at adjacent tables. In the restaurant study, 50% of people dining at the same table as the infected individual were positive within 7 days. At an adjacent table, 75% were infected. In a meat processing plant, the infected person transmitted the virus to a colleague working more than 26 feet away over 3 consecutive working days. In that situation, low temperatures combined with recirculation of inside air throughout the hall, combined with the high physical workload of workers with heavy breathing, were suggested as factors that enabled transmission over longer distances. So, should we shut down everything? Well, let me tell you one more story. There were 2 infected and symptomatic hairstylists that ended up treating 139 clients between the 2 of them. They wore masks. Their clients wore masks properly over the nose and the mouth the entire time. 0 symptomatic cases were reported. And of the 67 clients that were tested, all of them ended up negative. So proper mask usage can work. It can reduce spread of the virus when worn properly by all parties. And of course, we need to continue to wash our hands to prevent spread from high-touch surfaces to our mouth and our nose. But most important is to be highly aware of the environment and how we operate within it. Are we wearing masks at all times, including during meals? Eating and drinking will complicate that. Are we consistently greater than 6 feet apart? Is the ventilation with outside fresh air adequate? And how are we breathing or singing or cheering? And we need to understand that even under those perfect conditions, that does not eliminate the possibility of the spread of transmission. It merely lessens it. Believe in the science, please. Use good decision-making tactics and wear a mask. Thank you again, and I would be happy to take questions at the end. I am now happy to turn it over to Dr. Rue.
Thank you, Dr. Higa, and thank you to Secretary Levine and Governor Wolf. I thought I'd share, my name is Jaewon Rue. I'm the president and CEO at Geisinger. I thought I'd share some of what we're seeing with the recent rise in COVID activity and its impact specifically on Geisinger's responsibility to take care of the health needs of the communities that we serve. And really, it's the health needs of the community, not just for the COVID patients, but even for the non-COVID patients, because as we all know, the heart attacks, the strokes, the GI bleed, those kinds of things are still happening in our communities. And we, as hospitals and health systems, still have a responsibility to be available for that kind of care. COVID has frankly stretched our ability to do that. If I go through some of our numbers, I think they mirror some of the numbers you heard earlier that the state is experiencing throughout its territory. So in our hospitals, over the last 6 weeks, we've seen a tripling of the COVID positive patients, and that's happened since about mid-October. And if you go back to Labor Day, it's actually sextupled, so times 6. And this recent wave, we're seeing a spike that's about double or more than double of what we did back in the spring. So I think the concerning trends and the rate of climb are truly things that give us tremendous pause. The second point that we track pretty regularly is positive daily tests. And if you look at what that's done, if you rewound the tape to the first half of November, we were about 200, maybe a little less than that, positive tests per day in our system. For the second half of November, that climbed to 340. And for the first part of December, we're now at 470. So again, the trajectory and the rate of climb of the virus and of the activity of the virus are things that make us very concerned. The positivity rate of the testing, so what percent of the tests that you do come back positive, we have been hovering between 23 and 26% as a system on that. And that's compared to the summer months where it was less than 3%. So again, these leading indicators suggest that the 7 to 14 days ahead and maybe even the weeks thereafter are going to be difficult for us. And what we've done at Geisinger, several weeks ago, we started modulating and scaling back on our non-emergent procedures and services. And on any given day, on any given campus, we've scaled that back between 10 and 50%. But despite that, beds are pretty tight. If you look at most of our campuses, we're operating pretty close to 100% of capacity at this point, which makes it very difficult and challenging to still be able to accommodate the needs of all those other care needs outside of COVID. I think it's also more concerning at this point because it's demonstrated that it truly is in the community. I think you heard Secretary Levine share some numbers. It's remarkably similar to what we're seeing where it's not just the elderly. 35 to 40% of the admitted patients we have in recent weeks have been younger than 65, and roughly half of those have been younger than 55. And only about 10 to 20% of our recent cases have been from nursing homes. So it really demonstrates it's not coming solely from elderly patients, not coming solely from the nursing home, truly is out in the community. Now, there is some good news. I want to make sure that we reiterate that as well. We have more arrows in our quiver, if you want to think of it that way, as far as how we treat the virus versus where we were in the spring. But despite that, it is impacting our frontline caregivers as well. It's putting additional strain on our system. And as I mentioned, our frontline caregivers and workers, I'd be remiss if I didn't give a big old shout out to our workers, but also even outside of Geisinger, all the healthcare workers out there. I think they just deserve a true shout out because they've risen to this occasion. But as I walk around and talk to our employees, I think the prevailing theme over the last couple of weeks has been this feeling like they're just bailing water, but there's still a big hole at the bottom of the boat. And somehow we have to figure out how to increase the number of buckets we have to bail, but more importantly, how to decrease the amount of water in these boats. And so we have been out there really encouraging folks and the community that it's important to get upstream, to turn down the spigot so that we can shut off the valves that are putting more water into the boats. And we think that that's going to make a big impact. In fact, the biggest impact on our ability to continue to serve the care needs of our communities. And that's why we believe the upstream mitigation efforts are going to be needed. I think Dr. Higa did a great job listing out some of where those higher risk environments are. I think it's absolutely promising. We're very encouraged and excited about the vaccine soon coming on board here. But the distribution for that will still take months. And so in the meantime, what do we do to reclaim the capacity that the health systems need to take care of our communities? That's where these upstream mitigation efforts can play a pivotal role. So I'll pull up there. I want to pass it along here, pass the baton to my colleague, Dr. Chris DeFlitch from Penn State Hershey, fellow ED doc. So I'll hand it over to him.
Dr. Rue, thank you. Panelists, I appreciate you having here. First, I got to apologize. I literally just finished a shift in our emergency department over here at Penn State Health. And so apologize for the look, but I think I can give you a little bit of view of real life. First, thanks for having me here and allowing me to share a few comments about this long marathon, this pandemic. I can't tell you how proud I am to be a Pennsylvanian and how proud I am of the healthcare workers at Penn State Health and really across the Commonwealth. What we've been able to do for the people of Pennsylvania in trying situations. It's been a long fight. It's 10 months. We've been doing this for 10 months and healthcare providers are tired. But I think it's worthy of just taking a few minutes to remember all the things that have happened to get us to this point, many of which are amazing. So think about this. Back in the spring, we had this virus. It was a novel virus. We had no idea what was going on with it. We're getting information left and right. And we worked through it together. We innovated together. We figured out how we could work as a team, our coworkers, our families, our neighbors, coming together, and we kept saying, flatten the curve, flatten the curve. We heard that over and over and over again. We did it, okay? We did it. But this is a different time, okay? This curve and this surge is a completely different animal than what we talked about in the spring. But remember, we did learn a lot of things. We learned about how to care for patients in an ICU. We learned how to segregate out parts of our hospital and healthcare so that we have COVID units that are protecting patients with COVID, and parts of ICUs and operating rooms that are ready for patients who need operative care or ICU care that's outside of COVID. We've learned what medications work when you need hospitalized, which makes sense for this patient and doesn't make sense for this patient who has COVID. We've actually learned a lot about home care of COVID. And I think one of the things that I think is one of the most important things that have developed in this time frame is the use of telemedicine. Penn State Health on Demand and other applications that are available for Pennsylvanians to use from their home, from the safety of their home, while still maintaining care with their care providers, getting acute care, providing free coronavirus screenings and testing if needed. That probably would not have occurred without this. So we have risen to the challenge. But let me make, by the way, the virus vaccine is incredible. The time to get to a vaccine that really looks very promising. And when it's available for us to be able to distribute to the very tired healthcare workers who are out there in the community, it's just an amazing thing to get to this point. But, there's a lot of experience. There's a lot of learning here, but it's 10 months later. And this surge is nothing like the spring surge. As Dr. Rue pointed out, the volume is significant. The number of patients, the variety of patients, the number of patients who are at home positive, the number of patients that are in hospitals and ICU positive is significant. And there are things we can do. I mean, we don't, this is not a bleak picture. This is another opportunity for Pennsylvania to come together to fight this infection. You've heard us talk about this before. We need to have the capacity of our healthcare systems to provide care for COVID patients and for non-COVID patients. And you know what to do. We've been talking about this for a long period of time. It's about wearing a mask, and not sometimes wearing a mask, not partially wearing a mask, not covering your nose. It is about being diligent. It is about being persistent about wearing the mask and wearing the mask all the time. It's about washing your hands and washing those surfaces, especially in common areas. It's about doing the things you can do in your bubble with your family to maybe not spread around as much as you'd like to with the Thanksgiving or the other holidays or Hanukkah. We can protect each other and ourselves with that. It is really, really, really important. These are actions that you can take today. And of course, social distancing, maintaining that social distancing, not relaxing, but maintaining that diligence associated with it. And I'll add a fourth, that vaccine is really important. We want to protect ourselves. We want to get immune as individuals, and collectively, we want to produce community immunity. All of us together can do that. On behalf of the healthcare workers who are working so diligently and are so tired, but remain so compassionate and remain so caring for all those patients we take care of. I'm proud. I'm really proud to talk about that here. And if I can say anything to the public, one, thank you for what you've done in the spring. And it's really even more important for you to be diligent now about maintaining your hand washing, always wearing a mask, remain socially distant, and when available, get that vaccine. Thank you for having us at Penn State Health and myself here. And now I'd like to turn things over to Governor Wolf.
Thank you, Dr. DeFlitch. I really appreciate that. And Dr. Rue, Dr. DeFlitch, Dr. Higa, thank you all for joining us today in this announcement. And as always, Dr. Levine, you've done tremendous work, and I appreciate everything that you're doing. But again, thank you for being here, and to everybody out there, thank you for joining us. First of all, let me just start saying, by now you've probably all heard that I tested positive for COVID-19. I announced that, I guess, Yesterday, I actually tested positive on Tuesday at a routine test. All employees who are at the Pennsylvania Emergency Management Agency, which is where I hang out when I'm in Harrisburg, are tested every Tuesday, and my test came back positive. I'm in isolation at home. I'm following CDC guidelines, the Department of Health, Pennsylvania Department of Health guidelines. So that's why I am joining you, like all these others, remotely today. I'm feeling well. I'm continuing to perform all my duties, but I have was tested positive. I'm quarantined. My most recent test is negative, so I think I'm through this, and will stay in quarantine until I'm allowed to come out or test out of it. But I'm feeling fine, and I appreciate all the well wishes that I've gotten from everybody. But my test results are a reminder that even if you follow every precaution, which I have, there's no guarantee, as Dr. Higa said, there's no guarantee against getting COVID-19. And it's just a reminder that we all need to be working together now more than ever to protect one another and stay safe. I think Dr. DeFlitch is right. We're in a really unusual time here, but there is light at the end of the tunnel. It's not like back in March. We know more about it. We're more prepared than ever. But this is something that we've got to get through so that we can get back to life as we want it to be. This is so frustrating and so painful, but we can get there. And there is light at the end of the tunnel. The point is right now, the problem we're all facing is that this virus continues to rage in Pennsylvania. And over the past several weeks, it's become clear that we need to take further mitigation actions to protect Pennsylvanians and stop the spread of COVID-19. We all hoped it would not come to this. I mean, that's the point. The current state of the surge in Pennsylvania, though, will not allow us to wait. We need to slow the spread right now in order to save lives. If we don't, we're going to be in big trouble. So today I'm announcing additional temporary COVID-19 protective mitigation measures in the Commonwealth. The measures go into effect on Saturday, December 12th at 12:01 a.m. Friday into Saturday, and they expired Monday, January 4th at 8 a.m. With these measures in place, I hope that we accomplish three goals. First, I want to stop the devastating spread of COVID-19. Second, I want to keep our hospitals and our healthcare workers from becoming overwhelmed. As Dr. DeFlitch said, we're now in the 9th or 10th month of this pandemic. People are really tired. We're all tired, but our healthcare workers, above all, are really, really tired. And we want to make sure that we keep them from being overwhelmed. The third thing is to help Pennsylvanians get through the holiday season and closer to a widely available vaccine, that is the light at the end of the tunnel, as safely as possible. This is a bridge to that better future that we all know we can get to in Pennsylvania. We know that COVID-19 thrives in places where people gather together. And therefore, these protective mitigation measures target high-risk environments and activities like those. And they aim to reduce the spread of this devastating virus. So here are the things that we're going to do starting Saturday. First, extracurricular activities at schools will be suspended, including tournaments and practices. Second, indoor gatherings and events will be limited to no more than 10 people. And outdoor gatherings and events will be limited to no more than 50 people. Third, indoor dining for this 3-week period will be suspended. Takeout delivery and outdoor dining operations remain in place, and to support our restaurant industry, please do all you can to order online. Fourth, indoor operations will be suspended for this 3-week period at theaters, at concert venues, museums, movies, the arcades, casinos, bowling alleys, private clubs, and all other similar entertainment, recreational, or social facilities, as will indoor operations at gyms and other fitness facilities. Fifth, in-person businesses that serve the public, like retail, may only operate at up to 50% occupancy. Now, I know this pandemic has been hard on businesses throughout the Commonwealth, and it has been crushing for restaurants and bars. Unfortunately, COVID-19, that virus, thrives in places where people gather together. It spreads most easily when people are spending time together, talking with each other, talking without masks on. And these are the same conditions that we find in restaurants and bars. This has been shown study after study. It's not the fault of the restaurant owner or the bar owner or their employees or their patrons. It's not their fault that COVID spreads easily in these conditions. It's just the nature of the disease. It's unfortunate. The vast majority of restaurant and bar owners have been responsible and highly conscientious throughout the entire pandemic. But this virus is insidious, and it's spreading too quickly right now to make gathering indoors a safe activity. As much as we'd like it to be otherwise, it isn't otherwise, especially when it's not possible to wear a mask. I don't know how you wear a mask when you drink something or eat something. Since summer, I have repeatedly called on Congress to pass the Restaurants Act and direct COVID-19 relief funding to Pennsylvania's restaurant and bars industries. There's actually a good bill sitting in Washington that could do this, the Restaurant Act. But we need to make sure that these business owners and their employees have the help that they deserve and that they need to weather this pandemic. And we need our federal leaders to step up and provide the support these businesses need. That's a fact. The measures I'm announcing today are intended to be temporary. Again, they go into effect on Saturday, day after tomorrow, December 12th, and will remain in effect until Monday, January 4th. It's 3 weeks. For the next 3 weeks, please, I ask all of my fellow Pennsylvanians to stand with me, united against COVID. I'm asking that we work together to turn the tide of this surge so that our communities can safely bridge the gap between where we stand today and when a vaccine is widely available. By working together to stop the spread over the next 3 weeks, we will be saving lives, but we have to do it together. Each of us has the power to make a difference in the lives of our fellow Pennsylvanians by taking small steps to reduce our own COVID transmission risk, our own footprint. We each have that power. We each have that agency. I strongly encourage Pennsylvanians to follow our stay-at-home advisory. I understand that there's perhaps nothing more important than human interaction, especially within families. You know, when you're not able to see members of your family, that is not a small thing. That's a big thing. But we need to stay safe. So before you leave home, ask yourself, do I really need to make this trip? Do I need to really leave? And if you have to, then think about how you can do it as safely as possible. Wear a mask. Keep your distance from others who don't live in your household. As Dr. Higa said, avoid poorly ventilated spaces and wash your hands frequently. The point is, the situation we are in right now is dire. It's worse than it was in the spring when we first took action to flatten the curve. With so many cases circulating in the community right now, the kinds of everyday activities or small gatherings that might have felt low risk in the summer are substantially much riskier today. But every time we do one of the little things that lets us be safer, we're working together for that brighter future, and it's going to get here sooner. A study recently published in the journal called Health Affairs demonstrates that a vaccine is going to be able to protect our communities better and faster if the virus is already under control when the vaccine arrives. That means the work we do now to slow the spread of COVID is not only crucial to keeping our fellow Pennsylvanians safe and healthy right now, it's going to help us all get back to normal as quickly as possible. And it means more Pennsylvanians will be alive to celebrate that brighter future that's coming. This year, we show our love for our families and friends by celebrating safely and protecting one another. Let's work together right now to stop the spread of this virus. Because when we wear our masks, when we stay safe at home, when we avoid gatherings, we actually save lives. We get our own lives and get our own lives a few steps closer to that normal that we all want to get to. When we do the small things that keep each other safe, we aren't just fighting against COVID-19, we're actually fighting for a safer world and for safer holidays next year. We're fighting for next year's birthday celebrations. We're fighting for next year's family gatherings, graduations, weddings, bar and bat mitzvahs, parties, dinners out. We're fighting for the safety to get our kids back into classrooms and visit our families. We're fighting for the special occasions and the everyday moments we're all missing so badly this year. Together, we're fighting for a world where our friends, our neighbors, and family members are alive and healthy to spend holidays with us next year and for many years to come. So let's do this together, Pennsylvania. Thank you. And now all of us will be happy to take questions.
Thank you very much, Governor Wolf. We're going to go to questions, and our first reporter is Tyler Pratt from WLVR. Tyler, you should be able to unmute and ask your question.
Good afternoon, Governor. I'm glad to see that you're doing well. I have a question for you with a follow-up. The first being, you've been able to ascertain who you've come into contact with and who's had to quarantine?
Yes, I have. Thank you for asking. Thank you for your well wishes. I appreciate that. Yeah, that's a great point. I had a long session, not a long session, very easy session actually yesterday with someone in the Department of Health who called to follow up and do the contact tracing. Fortunately, I've been very responsible in terms of staying home whenever I could, teleworking where possible. And when I go to Harrisburg, go through all the checks and stay as isolated there as I possibly can throughout the day. So and I also have the app and use the app. So everybody, the few people I was in contact with were pinged and know that they need to quarantine. So as far as I know, everybody has been contacted and that has worked out the way it's supposed to work.
And as a follow-up to your mitigation orders, what would you say to businesses, particularly indoor restaurants, that have been preparing for months for this winter and buying supplies to deal with in-person dining now that they're closed? Will there be any support offered to them?
Well, as I said, financially, what I have been suggesting and arguing for and trying desperately to get since August is funding from CARES Act money that we had here at the state, which is going for other purposes, and trying to engage the federal government to do more for the restaurant industry. Again, as I said, it is no fault of the restaurant owners or the bar owners that the virus really does well in those environments, or owners of gyms or those kinds of facilities. But that's the fact. So we can ignore that. Or we can do what you're suggesting, and that is do what we can to get financial support for the workers and the restaurant and bar owners who are suffering so disproportionately through this pandemic. None of us likes this situation, nobody. But it's what it is, and we need to figure out how we can best navigate our way through that, and that's why these targeted, limited mitigation efforts, I think, are important as we all wait for the holy grail out there, the vaccine.
Thank you, Governor. Thank you, Tyler. Next up, we have Liz Kilmer from WPXI. You should be able to unmute, Liz.
Hi, Governor. Thank you for taking my question. I think piggybacking off of my colleague, for small businesses, you talked a lot about restaurants. This is going to be so devastating. And, you know, this is the government putting people out of work right before the holidays. The federal judge ruled that the previous lockdown was unconstitutional. What can you say just regarding your belief that this is constitutional? Is this the only way? And what else, if anything, can be done to help these small business owners?
Well, first of all, it's not the government putting businesses at risk. It's the virus. I think let's keep in mind all of us are doing the best we can to fight this virus. And as everyone, Dr. Rue, we first talked to, and Dr. DeFlitch and Dr. Higa, we're all concerned that if we don't address this correctly right now, we are going to face even worse problems with the hospitals and our healthcare system that has to take care of us all. If they're not able to do that, that's going to be a bigger problem than anything else we could possibly imagine. So we're not targeting anybody, the virus is. And we're trying, as the government, working on behalf of the people of Pennsylvania, try to figure out what's the best way we can act right now in a targeted, measured way in a restricted way to actually allow us to get to the point where we have the vaccines. The vaccines, as Dr. Levine can talk in more detail about this, but should be starting to be available next week, I hope. But it's going to be time before people get through the different, I think the first 2 rounds, vaccines are going to take two shots. But what we need to do is get through the period right now. That's what I'm trying to do here. And again, it's the virus virus that is dictating this. And all of us, I think, need to focus on the effort, the most targeted and the most effective ways to actually deal with this. So again, as I said, it's unfair. We're frustrating. It's terrible. But when we get together with other people for whatever reason, it's a real problem, and that's what the virus really likes. If we want to fight this virus, that's what we're going to have to deal with. And it's as uncomfortable as it is. Rachel, you want to talk a little more about the vaccines?
Yes, sir. I'd be very pleased to talk about the vaccine. So we're very, very hopeful that that the FDA today, actually, and the CDC tomorrow will be authorizing the Pfizer vaccine. And then we anticipate the distribution and then the administration of the vaccines as early as next week. The Pfizer vaccine would be first distributed to hospitals such as Geisinger Health System and Penn State Health System, where they'll be immunizing their healthcare workers, thought of very broadly. And then we anticipate potentially in a week or more, the Moderna vaccine, the second vaccine, to be authorized by the FDA and the CDC, and then also again distributed to hospitals for administration to healthcare workers. At that time, we also anticipate that the Pfizer vaccine will be also distributed through our pharmacy partners at CVS and Walgreens to nursing homes and other long-term care living facilities through the end of December and then into January. So as you've been saying, there is a light at the end of the tunnel, but it is going to take time as we work to distribute the vaccines through the different phases through the population of Pennsylvania. We, of course, have to take a very careful health equity lens as we look to make sure it's fair for everyone in terms of getting the vaccine.
Thank you, Dr. Levine. Our next reporter is Samantha Zern from PLS. Samantha, you should be able to unmute.
Hi, Governor Wolf. I'm curious whether anything will change with regards to how these measures are enforced, particularly with regards to private gatherings. I know we've heard from y'all before that small private gatherings are spreader events. So, is there anything new to how enforcement's going to happen?
Well, thank you. It's a good question. We've been increasing our enforcement efforts, and we'll continue to do that. We've engaged, obviously, the state police and the Capitol Police and all the other state enforcement officials, but we're also working with local law enforcement. And then you have local health departments. The Department of Agriculture has some regulatory capacity, Department of Revenue, the Department of Labor and Industry. So we're working through all of those to continue to do whatever we can to increase enforcement. So yes, we will. That's a very important part of this.
Thank you. Next up, we have Ford Turner from the Morning Call. Ford, you can go ahead and unmute. Go ahead, Ford. He may be having a little bit of trouble unmuting, and we can go back to him. So next we'll go to Hannah Brandt from ABC 27. Go ahead, Hannah.
Hi. Yeah. So my first question for Governor Wolf, we know that you tested positive for coronavirus. We've also heard that you've had negative tests as well, but of course you're still quarantining. What does that say about whether or not Pennsylvanians should trust the tests that they're being given?
Well, the hope is that everybody goes through that you test positive, you get the disease, and eventually as you come through it, you test negative, and that's what's happened here. So I tested positive, and then have had tests since then and have tested negative. And again, as people go through this disease, I hope that's what happens to everybody.
So your belief is that it's not a false negative, instead that you don't have the coronavirus any longer?
Well, the process is that you actually have a number of tests to confirm that, and I have not yet gotten the results of my latest test, but the hope is that confirms that I am indeed now negative.
And then one more follow-up question, sorry, for Dr. Levine on the vaccines. We've heard that the CDC wants to collect personal information about people and use that data on the vaccines. Is Pennsylvania planning to turn over information from people, personal information for people who are getting the vaccine?
Well, so the CDC has a data agreement process, and so Pennsylvania will be working with the CDC, and we have been able to work through the data agreement. They're not going to be collecting identifiable information, so they're not going to know exactly who a person is or their exact address, but they are gathering demographic information so they can understand who responds to the vaccine best, who might have any particular issues with it. And so, this is not a new process. We work with the CDC all the time on many diseases and pass on non-identifiable data to the CDC.
Great, thank you.
Thanks, Dr. Levine. Next up, we have Paul Go from the Pittsburgh Business Times. Go ahead, Paul.
Hi, thank you for taking my call. I wanted to know, obviously these measures are going to go in effect and there's a lag, so things are going to be worse before they're better, I would assume, given everything that's happening. Can you tell me, what your projections are for when this could start to see some impact with these mitigation measures? And then also, if the situation continues to deteriorate for whatever reason, what additional actions are you contemplating or willing to take?
Well, I'll turn it over to Dr. Levine for the modeling, because we have a number of different models that we're using for this. But at this point, we're not thinking about anything else. So, Rachel, do you want to take the modeling question?
Sure. Thank you. It always takes at least approximately 2 weeks for mitigation measures like this to start to show a decrease, right? Because the incubation period of the virus is up to 2 weeks. So with these current mitigation measures, we're hopeful that we'll start to see an improvement by the end of December. The models that the governor were talking about, and we follow a number of different models, but one of them that has been used nationally as well is the IHME model, or the Institute of Health and Metric Evaluation. And that's from the University of Washington. And that has been a very, very concerning model. There's a recent update in the last week that shows in terms of the number of new cases, we're seeing 11 up to 12,000 new cases a day, that by the end of the month, we could be seeing 15,000 up to 20,000 new cases a day. If we're seeing now we're seeing actually over 200 deaths a day, that could be higher. And they anticipate, if nothing was done, that we could be seeing significant amount of deaths by the spring. So that is why the governor is acting now. And why the mitigation measures have to go in place now to work to stop the spread.
Let me just add to that if we do these things and people wear masks and practice social distancing and make responsible individual decisions, the numbers are going to be very much better than the model predicts. If we do these mitigation efforts for 3 weeks and we don't do those, we don't each follow these things are going to be worse. So it's a bit of a moving target, but these 3 weeks, if we all pull together here and do the right thing, we should be able to be in a much better place by the time the vaccines arrive.
Thank you, Governor. Next, we have Flora Pastorera from PennWatch. Flora, you should be able to unmute.
Thank you. Governor, I think there's a little bit of a confusion. On Monday, you said that you were working on a plan to actually help restaurants and said that they were taking a hard hit and they were going to take an even harder hit during the holidays. It seems that your actions today are not going to help the restaurants. They're going to hurt them even further. And some of the restaurant owners have already said that they can't survive and they're going to defy the order and stay open. What will happen to them if they in fact stay open over the next 3 weeks for the indoor dining?
I think what you're talking about is the financial work, and I continue to support. The U.S. Senate is considering what they're calling a compromise that actually includes help for restaurants. I will look at anything working with the General Assembly that we can do here in the shorter term to make sure that we help those restaurants. Again, as I said, there is no question that restaurants and bars have been really hard hit by this, and we're coming into a really tough time for this mitigation effort to take place, because it really does make a hit into a very busy time for what would otherwise be a busy time. But it's also the kind of thing that the virus really likes. We need to try to stop that virus.
So what will happen if they in fact defy the orders and continue with indoor dining over the next 3 weeks?
Well, we have the enforcement in place. There'll be the usual citations and fines.
Thank you, Governor. Next up, we have Jamie Martinez from Spotlight, PA. Jamie, you should be able to unmute.
Hi, thanks for taking my question. Governor Wolf, we've been talking about the fall and winter surge for months now, since the summertime. Why weren't these mitigation efforts put in place sooner and put in place so aggressively sooner?
Yeah, because the surge wasn't as bad. The holiday season, this really, we think, stems from families getting together, the heavy travel that took place over Thanksgiving. And I don't think anybody foresaw that. When you go back to September and even October, it really wasn't as bad as it is now. It has taken off exponentially. So the hope was that the things that I did put into place would be enough to take us through the Thanksgiving season. It didn't work out as well as I hoped it would.
Thank you. Go ahead.
If I can follow up on that, what are you going to be looking at to measure success? I mean, I guess what I'm asking is, how will we know that these mitigation efforts are working?
I think that the things that Dr. Levine talked about, the hospitalization rate, we really have to look at that. I think Dr. Rue was the first one to call and say, this is a problem. And as he said in his comments today, it's one thing. The hospitals are doing tremendous work to try to balance their responsibility here. But just, he mentioned all the things that we can't afford to have a healthcare system that's so overwhelmed that it can't deal with heart attacks or accidents. Well, another thing is, we're not even talking about influenza. The flu season really started in October, but it's been pretty mild so far. The worst months for influenza are typically January and February. So we've now gotten to a point where things have really taken off. We've been lucky so far with influenza, but I don't think we can expect to be that lucky for that much longer. And we just can't afford to let things keep going the direction they're going. And since we've gotten into November, things have taken off really exponentially. And as Dr. Levine said, as the models show, if we don't do anything, it's going to get worse even faster. So this is the right time to do it. If we had known more, maybe we would have done it a week earlier, but we need to act as early as we see the need.
Thank you, Governor. Our last question today is going to be from Annie McCormick from 6 ABC. Go ahead and unmute, Annie. I'm asking you to unmute, sorry. It seems to be stuck.
There we go.
Sorry.
We're wishing you that's okay. We're wishing you a speedy recovery from Philly, Governor.
Thank you.
I wanted to ask you, we heard Dr. Higa talking about the studies in regards to transmissions. At this point, the restaurant industry has been asking to see the data to justify closing indoor dining, both from Philadelphia's health commissioner and also from the state. What studies, if you are relying on, what studies are they, or what data are you relying on that prove that the transmission rates are high in restaurants and some of the other businesses that are having to close?
Well, I'll ask Dr. Higa to answer this, but there are studies that we're using from Yale, from Stanford, studies from even Chase Manhattan Bank on their credit card use that's happened over the summer. I'm not sure I've seen anything that says anything other than when people get together, take their masks off, drink and eat together, and are in close quarters, that anything good happens when it comes to the virus. That's just the reality. So, Dr. Higa, am I missing something there?
No, I mean, there's a number of different studies that are out there, and I can provide the references that I have here, but that's only, the tip of the iceberg in terms of everything that's out there. So there's a lot of studies that have been done and that are continuing to be done, but the evidence overall is fairly clear, I think.
And my follow-up sorry.
If I can this evidence goes back for about 6 months or more. So, studies that were looking at the increases that we're seeing, for instance, in the summer in Florida, in Texas, Arizona, California, there are CDC studies and other studies that showed that indoor dining, particularly indoor dining, where, as the governor was saying, you can't eat and drink and actually wear a mask. And as you're talking, people, while you're eating and socializing, especially depending upon the ventilation, the virus spreads. And Dr. Higa had quoted some studies about that. So, this is something that the White House Task Force highlighted in their weekly reports to states this summer, is that to bend the curve from the increases that we're seeing, particularly in the South and the West, that you had to close restaurants, limit, and then eventually, if necessary, close restaurants and bars and nightclubs. So this is not new information about the impact of restaurants, bars, nightclubs, et cetera. And it's worse now because it's harder to eat outdoors. And as Dr. Higa mentioned, the cold weather drives people indoors. And when you're indoors, it spreads a respiratory virus like this much more efficiently, unfortunately.
And just a follow-up question, are any of those studies done specifically in Pennsylvania? Do you actually have boots on the ground here of people that are doing the studies in our restaurants?
So I have not seen, I'll ask Dr. Higa, published studies from Pennsylvania, but we know from the contact tracing and the case investigations that were done through Philly, through Allegheny County, and that we had done, that restaurants, bars, nightclubs, et cetera, were contributing significantly to the spread. It is much harder to get that granular data now. And I've mentioned this before, is that when you're having 10, 11, 12,000 new cases a day, you have to prioritize your case investigations and your contact tracing. And so our prioritizations are primarily to congregate care settings. So that would be nursing homes, other long-term care facilities, corrections, schools, cases involving seniors. We're not able to reach 12,000 patients a day throughout the state. So both the Pennsylvania Department of Health as well as the County Municipal Health Department and our partners there have to prioritize contact tracing. But again, this is not new information about bars and restaurants. It's been known for at least 6 months. Dr. Higa?
Yeah, I think everything that you said is correct. And I would just say that I can't think of any studies that have been done specifically in Pennsylvania, but in the United States, certainly. And I've eaten at a lot of restaurants, and I don't find there to be anything extremely unique about our Pennsylvania restaurants that would make them very much different from any place else.
Thank you.
Thank you, Dr. Higa. Thank you, Governor Wolf. Thank you to Dr. Levine, Dr. DeFlitch, Dr. Rue. We really, really appreciate your time today. We appreciate everyone getting on the call. That is all the time we have for today. So we hope that everyone has a great rest of their day and stay safe and well. Thank you.
Thank you, everybody. Thanks for joining us.
Thank you.